Doctors running 68 accident and emergency departments have told Theresa May that patients are dying in hospital corridors. They blame the government's chronic underfunding of the NHS and dangerously short staffing levels. The result of this deliberate underfunding by the government is millions of patients suffering the longest ever waits for casualty care, beds, cancer treatment and operations. Earlier today, I spoke to Aislinn Macklin-Doherty, a junior doctor in the front line of an NHS in crisis. Aislinn, what would you say to Theresa May and Jeremy Hunt, both of whom still deny a crisis exists in the NHS?
Well, Peter, I think them coming out and saying things like this in total denial of what is happening, of what staff are telling them, of what patients are telling them, of the reality of patients dying in hospital trolleys in the 5th richest economy in the world, of patients now dying at home before they even get to hospital. For them to come out on national TV programmes like The Ma Show and deny that there is a problem, I think it just represents what we already know about this government, that they are totally out of touch, and to be honest, they're out of excuses, because they have been in government now for 8 years and they have spectacularly failed on the NHS. And to be honest, it's becoming very clear to the public that this is not an accident. The NHS is being pushed into a political crisis. I am seeing the NHS being carved up, fragmented and sold off so that they can make a profit at the taxpayers' expense. And this is one of the most important things that is happening to the NHS that a lot of the public don't realise, largely because the government isn't telling them, and what the government are telling them instead, that it's the elderly's fault, that it's the health tourists' fault, it's the migrants, it's the disabled, and it's the staff's fault. Staff like me who are absolutely working very, very hard to try and keep this all afloat. So I think the most important thing we can do is make everyone aware of the truth and get the message out that you can do something about it. Health Campaigns Together and People's Assembly are putting on a demonstration on the 3rd of February.
It's the 3rd of February?
Yes, in London. And we basically want everyone to be aware of what's happening, to get out there, be empowered, know that your voice matters.
One of our courageous frontline doctors telling it as it really is. We've got an NHS facing a crisis in staffing, in funding, social and mental health services at the point of imminent collapse. And we have patients dying at home waiting for ambulances, dying in accident and emergency departments, waiting hours to be seen, lying cold and in pain on floors of hospitals at 100% capacity. This is a political crisis manufactured by the government. It's time the government stopped blaming patients, nurses, doctors, immigrants and the elderly for its own failures. The government must heed the call of the public, of staff and patients who demand that our NHS is not only funded properly, but brought back into public hands. So please join the People's Assembly and Health Campaigns Together demonstration on Saturday, 3rd of February. That's Saturday, 3rd of February.